Hello, everyone, to the second episode of Radiology and Efficiency with Andy Milkowski. And today I have Maria Budhwani with me. She's the Chief Operating Officer of Georgia Health Imaging, which is outside of Atlanta. And you've been in that role for over 4 years. Previously, you have done some infrastructure work at the same organization for teleradiology, telecommunications to improve communications with primary care physicians. And I discovered the many talents you have, which include writing, photography, cinematography. Could you introduce yourself and maybe pull some of these things together and how they influence your current role?
Sure. Thank you so much, Andy. So I've been in this position as a COO for about 4 years, but before that, I actually helped establish the company back in 2003 or four. And I was just a techie kid. And if we really look at it in the past 20 years, technology, especially communications technology, has advanced so quickly that the company really needed somebody who was aware of what was going on and the changes that were coming with it. So I just dove in head first because I found it interesting. Didn't have a degree in it or anything like that. And my origin story of actually getting into all of that was that growing up, I had a sister who was not the best with technology. And I remember back in the day of AOL, we would get a virus like every other week. And so, I'm at 9 years old, I'm calling them in. I'm like, how do I fix this? How do I fix that? And it's just, practically hands on. This is what matters. This is what doesn't. And from then, it just kind of, snowballed into learning how to network and seeing how images and information could be passed faster and faster and more accurately. And that helped establish this whole practice that's been going on for over 20 years now.
Wow, that's a fantastic story. And they always say the best are always the ones that have done the work themselves, right?
Yes, absolutely. I didn't plan on it, but like I said, it dealt into my lap. And then we're looking at that 2003, 2005 time until now. We're looking at how internet actually became a thing, how personal computers, laptops, cell phones, smartphones that we have became a thing. And all of this within a 20-year span, literally went from 0 to 120 that we didn't have that kind of development before. And so that's where it really came into impact, especially in a healthcare organization that relies on so much visual data.
Yeah, it's true. Well, I look forward to clicking into some of that right now. If we could start maybe on the financial side as a chief operating officer, do you have metrics that really tell you the state of the business and whether things are doing well?
Absolutely. So there's two different ways I look at it. And mind you, I don't have a business background. Again, I got thrown into it. I learned it on the go. And I have two basic approaches where it's looking at how many patients I'm actually getting scanned per day versus knowing the average minimum rate of return I need to get. And then also looking at it in a broad aspect over like 6 months time, 9 months time on how I'm actually keeping us busier and increasing the number of patients and the more expensive ticket items, just really see where we're going. So for us, being a single practice, but also having been around for over 20 years and still one of the only privately owned imaging centers left in the metro Atlanta area, I've seen a shift really from going from previously having commercial insurance patients, and we know they're very low return. So with a basic lumbar MRI, I would get a return of maybe $125. And that's after authorization processes and administrative work and the technology going into maintaining the machine itself, maybe $125. And now I'm seeing that the majority of cases have gone into the PI and to workman's comp and self pay. People want less of spending all the money up front, not knowing if they still have to pay versus going into, hey, I'm just going to pay this up front. End all be all, that's it. With personal injury cases, it's always kind of out in the open. You never know what you're going to get, but you're going to get a basic minimum, which is at least 3 times, 4 times what the insurance companies would do. So I'm approaching it on that aspect where let's say if I have, 300 MRI scans a month, what percentage of those are actually PI cases, which I know the return is automatically higher versus insurance patients, which I know is always going to be a bit lower. And then how many of those have actually turned into direct self-pay cases? And those have increased a lot, particularly post-COVID. So 2021 to now the PI and the self-pay cases have continually increased, which is also reflective of the healthcare status within the country.
You have enough information in that response for a whole nother interview. If you were to look back and thinking about all of those challenges that you have in the changing for self-pay, what investments have you made recently that you think have paid off for you to help in those metrics?
Absolutely. That is number one, know who you're going to serve. We know the community. We know our metro Atlanta community for a long time. I've literally had patients come in every year for checkups for the past 10 years. I've had people come in from overseas. And I guess that's where my graduate degree in communications actually pays off because it lets me know how to communicate with people. And the healthcare system can be very scary for people if you don't know it. And so one of the things that has really helped us is actually being able to communicate with our patients in various languages, letting them know, what they need and finding mediums to communicate with them. So we're completely digital. We're able to email out and provide digital images so people have that access and they feel like they have ownership of their own exams and their own health medical records. And then it's also being able to continuously share that with their next provider. And I know things have started to trend that way, but you look at big hospital systems that use these types of mediums and it gets really complicated. I mean, even for myself, I was like, which one do I go to? What doctor? I don't get it. But this is straightforward. Like, I came here for my exam. All of my information is here, and I have the ability to share it anywhere. And I think that's probably the number one, giving people the ownership of their own health records. And we've invested in that by upgrading our PAC system within the last 2 years, and that's continuously updated with accessibility for patients, better kinds of protocols behind it, and then increasing the number or types of protocols or exams that we can actually do on the systems that we do have. We've been very fortunate. We have a great engineer who's been able to set it up where we have everything top of the line. And with that, we've been continuously able to upgrade and adding additional protocols for patients that need it. One example is that now we're working with a company that is actually able to take a single CT scan, whether it's of the chest, abdomen, or the pelvis, and not only get out a lung screening, I can also get out a bone density scan out of it. I can get a liver health scan out of it. I can get cardiac chamber volumetry out of it. And every little aspect of this requires only one scan. So it's offering patients more information without feeling like they have to continuously go in. So that I think those are two main ways we've actually gone back and invested into understanding what our patients need and using what we have to be able to provide those resources for the patients to actually get them what they need a lot faster, a lot cheaper, and a lot more accessible to them.
I'm taking away a couple of things from what you said. When people talk about PACS, you mentioned a facet of it that is not often talked about, and that's how it facilitates you being able to provide images for your customers. The second point that you mentioned is out of one scan, you're able to extract lots of dimensions of information, right? This is very interesting to me. How is that practically helping? Is it an incremental benefit to the patient only, or is you using that as a way to minimize the number of scans that you ultimately have to do on the patient?
Both. And I'll add a third to it. Obviously, profit wise, like we get paid more. But if I'm looking at CT scan, for example, CT has radiation. In general, we want to minimize the amount of radiation we're exposed to. So I can do a single CT scan, chest, abdomen, pelvis, right? A single combination scan. And even if I just limited one of those parts, let's say I did the whole chest, abdomen, and pelvis. If it's set up as a low dose CT scan, and then out of that, I'm getting a full lung analysis. I'm getting a chance to take a look at the whole spine, and I'm getting a chance to take a look at all of the organs. Plus, I'm able to derive more accurate bone density scans. So I don't have to have a DEXA machine anymore, right? That's real estate in my office that's opened up. But also, you have better data that comes from a CT scan than from from a DEXA machine. And then I'm able to do CVC scans, right? Cardiac chamber analysis. So how these chambers are pumping and, the volume and how healthy those are. Then that will also give me information about cardiac calcium scoring. Again, as our population ages, these are all the things that they need, right? The same goes for liver health as well, because it'll assess the healthiness and the density of the liver and the kidneys. And all of this can be done with one singular scan. So that's less time under a CT radiation, but more information, more accurate diagnoses. And once we get this information, having the radiologist combine with AI to actually pull out this information where a patient may have an anomaly or an area for concern. Patient had come in for a basic lung screening, no history of smoking, nothing like that. But came in and we found out that this patient actually ended up having severe cardiac calcification. And we would not have found it in another way. But here we are. Patient now knows, regardless of me going to my pulmonologist or this being just a routine scan for my primary, now I do have to go to a cardiologist.
Yeah.
And this is the whole point, right? We want to reduce the number of exams patients are getting, but give them as much as they can getting out of it. And with technology moving the way it is, that's what healthcare providers are supposed to do, take care of the patient. And now we have technological resources to give as much back to these patients with minimal actual exam time. Like that's our goal. And for a small practice, that's how we've worked. And it's been so beneficial because it makes patients happy. We get, of course, the additional scans on there, but also it's giving better overall health information for the community across the country, across the globe.
Yeah, you're certainly painting an inspiring message for radiology. Let's turn to your role running operation. And if you were to look at it for constraints, where do you think your major bottleneck is from an imaging perspective and bed turnaround time? Is it something else? What's your biggest constraint today?
Honestly, I would say it's working with the larger companies. And this is a very broad scope. And by larger companies, I mean you have your commercial insurance companies, you've got your government insurance companies, and then you have your large work comp companies, and you have private companies who provide kind of healthcare to their employee. I say that because there's so many different steps that they require providers to go through to actually get paid, that it's like, yes, we'll do the skin. Like our ultimate goal, especially with the company being here for 20 plus years, is providing a healthcare service because we understand how important health actually is, regardless of anything else. And unfortunately, people have put that on the back burner. I don't need it. But we'll go ahead and do these scans, and we have to go through authorization processes. We have to go to make sure those authorizations are actually accurate. And a lot of times, these people that are providing this paperwork aren't familiar enough with what the procedure is, the diagnosis is, which part of the body, and then going back and trying to bill them. They're like, no, we said the right shoulder, not the left shoulder. We're doing it based on the authorization, even if it's different from the doctor's order, because you've only authorized this one. And that's where it's like, we're trying to make it more accurate for patients. We'll do the scans, we'll provide the service, and then they've made a clerical error and it comes back. The patient gets delayed in getting their results. The patient gets delayed in updates in their cases, updates in their insurance. We're still waiting on getting paid, but we've already completed the service. And that's where it's like a struggle because we understand patients need it, but we're still a business. And so it's finding that kind of balance to be able to provide the service that we're here for and not getting stuck with the administrative or clerical errors.
Do you see any tools on the horizon that significantly help with all those, I'll just call them administrative issues? Because they're so multifaceted. Any aspect of it could go wrong.
Right.
Do you see anything that is on the horizon that could significantly help?
Absolutely. And this is an interesting question because this takes us straight into the integration of AI. And yes, the AI would help in kind of double checking accuracy and speeding up processes, but the AI only knows what you tell it to know. So if on the information that it has isn't accurate, if something as specific as one ICD-10 code, and there's like 10,000, 20,000 ICD-10 codes, that if it doesn't register that, it won't correctly say, hey, this is the appropriate exam for it. With various companies that has this AI in the back processing these authorizations, like, no, that's not the right one. But after doing these authorizations for so many years, I know which ones to adjust and how to set up to make sure this procedure gets approved. And yes, it'll help, but that technology has to improve a lot in terms of the scope of the information it has, but also, kind of really look at the human aspect where those people who are creating these AIs, these insurers, and these large corporations, where they're actually coming in and be like, it doesn't have to be this code number M25.501A SSS. I mean, come on, M25 is kind of a blanket exception. Like, you just have to go with it, right? So it's kind of figuring out where they'll actually settle at. But, in the same aspect, having AI integrated does make checking if there is an error, like it'll show up right away. And this has been done for a long time. But now it's reducing a number of denials, automatically making corrections. And of course, that in itself is a large process to undertake. And that's where we're at actually now as well, because we're trying to figure out what is the best source to be able to have this kind of administrative information integrated with AI be applicable to a radiology center. It's very hard to find one that's specific for radiology because the diagnoses and protocols in that are very different than any other practice within healthcare.
Yeah, it seems that you're saying that though there are some tools that are helping, we will be talking about this for many more years.
Absolutely. And there is a great benefit to it. Honestly, I've seen the AI integration being even more remarkable in the last 24 months. Like, it's one thing with AI being so, open in the public with ChatGPT, but it's another thing to actually see it in play because I'm seeing my radiologist and they are able to get the images. The AI does an automatic evaluation of it. At the same time, the radiologist is reading and dictating, and what the radiologist is finding with a human eye in conjunction with AI is producing more accurate reports that 15 years ago, even 10 years ago, we wouldn't have had. And so for the patient's benefit is that it's like always having a second consult on any exam that they're getting. And that is an incredible benefit. Just like the exams I had mentioned before, one single CT scan and I can get 5 scans out of it that give me such an enormous information source for patients and their health that is only possible with that conjunction of human and AI actually working together and not just relying on one or the other. It's just in a matter of improving that data set and understanding the limits of each.
Let's Let me turn the topic to staff. We could talk about radiologists and others in the news, the issue with staffing radiologists, turnover rates, quiet quitting, and all of that. Can you speak to any things that you've noticed or steps that you're doing to prevent problems?
Okay, so if we're looking specifically at radiologists, number one, it's always good to have a backup. We have our primary radiologist, and then we also have a backup, and we have a cardiologist on staff as well, and of course, a backup, because you never know what will happen. That's important. And two, I think it's very important where radiologists get so in the zone because they're looking at, hundreds of images a day, thousands of images a day, that it's always good to double check. And everybody has had cases where you sometimes get a duplicate report, but it's a different patient. So it's really important that even your administrative staff are making sure everything is accurate. And this goes back to, again, you always have a human eye, AI eye on it to make sure that there are no mistakes. And I have been very fortunate that we've had our radiologist partnered with us since the beginning, since 2003. So we've been able to work with him as he's grown. And so he's been doing this for about 45 plus years. And when MRI first came around, every quarter we'll go ahead and have an exam sent out to radiologist A and then radiologist B and compare the findings. And if they're the same, great. Just to make sure they're accurate and they're up to date in terms of what we expect of them and they know what they expect of us. And we have such a good relationship that our radiologists will be like, hey, I can look at this, but can you get additional set of scans on it just to make sure? I should say this is one of my proud moments is that we actually had a patient come in for a CT scan of the head. And we did the exam on him. And we're like, this is looking a little unusual. Within 10 minutes, our radiologist called in. He's like, this man needs to go to the hospital right now because he has an aneurysm in his head that is about to burst. And we told his family. They took him straight to the hospital. A few weeks later, they come back in. He had had brain surgery to get that taken care of, and his life got saved because our radiologist was like, this has to happen now because I don't know what's going to happen in 30 minutes.
Wow.
And that's the whole point, right? We work together as a team. And if we have respect for our radiologist, the same comes back to us. And that goes across all of our staff. We've had MRI tech stay on for many, many years. We've had our front desk stay on for many, many years. So it's creating an environment, whether it's the physician in themselves or health staff or clinical staff or administrative staff that realize that their input actually does matter. And they've given me fantastic ideas in terms of growth and looking at new avenues or things patients may need that they've been asking about. It's a team effort.
Sounds like you have a very motivated and long-term team. And so you haven't had to worry about, in the way you run your organization, you haven't had to worry about burnout issues.
No, because, like, we always have a backup, so we always understand. I think we've had more of a technology issue in that aspect because just recently, the PAC system server on our radiologist side had a major issue, some major hack. It happened for a lot of different server systems, and unfortunately, our radiologist got caught up in that. So I was like, "Oh, that's more of an issue than the actual report itself." Technology is one thing, but you still have the reliable people with the right kind of knowledge to be able to do the reading and understand what's going on with a patient. And human and AI, right? There's this integration, but also knowing that the human eye is very different and can do it without relying so heavily on an AI server being up.
That's fantastic. I imagine that you or somebody on the team be traveling down to RSNA in a week.
Yes, absolutely. I will be there. I'm excited because there's so much new technology that I'm so excited to look at. And as a techie on the side, this is fascinating. So bring
It's
it
a
on.
what's on your bucket list to check out while you're there?
I'm definitely going to be checking out this cardiac AI, CT integration with more of the cardiac AI, and then looking at a couple of companies that are offering like new protocols to add to current MRI machines where they can create high level DTI images and be able to essentially follow the neural pathways in the brain. And this is so important for people who have had strokes. Like I myself have had one. People who have had any other sort of TBI, car accidents, MS, and instead of having to go buy a completely new machine, they're creating these protocols to integrate it directly into the existing technology. And that makes it one more affordable, but two more accessible, right? You don't have to go to the big hospital in the city to go get this information. You can go ahead and get it at your local imaging center and get it done without having to go to a hospital that's going to charge three, four, five times as much.
My last question was going to be, what technologies do you expect to give you the greatest return or the nicest opportunity for you? But I think you're already answering that in terms of tensor imaging on MR.
Absolutely. I'm not a doctor, but I come from a family of doctors. And I've grown up seeing how so many people just don't give enough attention to their health, but health is so integrative to everything that anybody does. And we've had the opportunity to get bought out by larger chains, hospitals, and every time we've been like, no, because our bottom line is bringing affordable healthcare. And with that, that means doing our best to stay up with technology that all of these high-end hospitals, all of that, are doing. Being a techie and finding all of this really, really interesting stuff is where we found that patients are finding it fascinating too. Like because of the packs that we offer to our patients to be able to see their images, they are going home and doing a 3D render of their own body. It's one thing to see a paper report. It's another thing to see a 3D render of the part of your body that is actually hurting. That not only just educates patients, but it gets them more familiar with feeling, hey, this is my body. I know what I'm seeing and I know what the doctor is seeing. And being a small practice, we have the time to actually explain to patients like, hey, look, that's the concussion that you had. Or that's the torn meniscus that you had. And that makes a bigger difference. They're just not another chart that comes through. It's being able to give this advanced technology, advanced information for patients because we've been on the other end. I've had my very own machine diagnose my own stroke, and that made such a big difference knowing it. Not having a medical background or a business background, but we all have to know what's there to learn from and what's there to make better.
Maria, I'll take that as a close. You've given us quite the inspiration for you personally and for the rest of the organization. I want to thank you for the time and all the insights that you've given. You definitely have had some different perspectives that I think others will enjoy listening to. So I
Well,
appreciate.
that's great, Andy. I appreciate the invite, appreciate the conversation, and I'm always ready for more.
Excellent. Thank you. This is Andy again. I do these interviews to keep close to all of you trying to run, grow, and optimize practices. It's my way of giving back. So I do hope you enjoyed this interview. Remember, give this video a thumbs up and share a comment. Also, if you know someone I should interview, please connect us. And if you are still dictating everything, please reach out. All my contact information is below. Thanks.